Temporal Bone, Part 2. Petrous Part. Introduction. The petrous part contains, in its interior, the components of the inner ear. It consists of an apex, a base, and three surfaces, anterior, posterior, and the inferior. The apex is received into the angular interval between the posterior border of the greater wing of the sphenoid and the basilar part of the occipital. It presents the anterior or internal orifice of the carotid canal and forms the posterolateral boundary of the foramen lacerum. The base is fused with the inner surfaces of the squamous and mastoid parts. The anterior surface forms the posterior part of the middle cranial fossa and is continuous with the inner surface of the squamous portion. The posterior surface forms the anterior part of the posterior cranial fossa and is continuous with the inner surface of the mastoid portion. The inferior surface is rough and irregular and forms part of the exterior of the base of the skull. Petrous part, anterior surface. Petrosquamous suture unites the anterior surface with the inner surface of the squamous part. Arcuate eminence is present near the center of the anterior surface and indicates the location of the superior semicircular canal. Legmen tympani is a thin plate of bone lying anterolateral to this eminence, which separates the tympanic cavity from the cranial cavity. The hiatus of the facial canal is an oblique opening for the passage of the greater superficial petrosal nerve. A smaller opening is occasionally seen, lateral to the hiatus, for the passage of the lesser superficial petrosal nerve. Termination of the carotid canal is present near the apex of the bone. Above this canal lies a shallow trigeminal impression for the semilunar ganglion. Petrous part, posterior surface. Internal acoustic meatus is a large orifice of variable size, with smooth and rounded margins. It leads into a short canal, about 1 centimeter in length, which transmits the facial nerve, acoustic nerve, and the internal auditory branch of the basilar artery. External opening of vestibular aqueduct lies behind the internal acoustic meatus. It is a small slit, almost hidden by a thin plate of bone that transmits endolymphatic duct. Subarcuate fossa is an irregular depression, above and between these two openings, which is prominent in infants. Petrous part, inferior surface, part 1. Behind the apex, on the inferior surface, there is the large circular aperture of the carotid canal, which transmits the internal carotid artery into the cranium. The jugular fossa is a depression of variable depth and size behind the aperture of the carotid canal. It lodges the bulb of the internal jugular vein and forms anterior wall of jugular foramen. In the lateral part of the jugular fossa is the mastoid canaliculus for the entrance of the auricular branch of the vagus nerve. Pyramidal notch is a triangular depression in front of the jugular fossa and medial to the opening for the carotid canal. It lodges the inferior ganglion of glossopharyngeal nerve. At the apex of this notch is a small opening, the cochlear canaliculus containing aqueduct of cochlea. In the bony ridge dividing the carotid canal from the jugular fossa is the small tympanic canaliculus for the passage of the tympanic branch of the glossopharyngeal nerve. Petrous part, inferior surface, part 2. Behind the jugular fossa is a quadrilateral area, the jugular surface, articulating with the jugular process of the occipital bone. Extending backward from the carotid canal is the vaginal process, a sheath-like plate of bone, which divides behind into two laminae, lateral and medial. The lateral lamina is continuous with the tympanic part of the bone. The medial lamina continues with the lateral margin of the jugular surface. Between these laminae is the styloid process. Between the styloid and mastoid processes is the stylomastoid foramen. It is the termination of the facial canal and transmits the facial nerve and stylomastoid artery. Situated between the tympanic portion and the mastoid process is the tympanomastoid fissure for the exit of the auricular branch of the vagus nerve. Thank you.